Well, good afternoon, everyone. Thanks for staying with us to the section on counselor supervision. Hope that you've enjoyed the symposium so far. We have this section on counselor supervision training and the GW counseling internship. So welcome. I am Dr. Hergenrather. I am a professor of rehabilitation counseling in regard to internship and supervision. So I have instructed the internship practicum courses for 22 years at GW, more than 67 sections, and I've served as a supervisor and a group supervisor. So we'll be able to, Dr. McGuire-Kulitz and I will be able to provide you with some experiences that we've had, but we'll also ask for some of the experiences that you've had. And Dr. McGuire-Kulitz, my co-presenter here, I'm honored to have you with me, as we are the co-directors of the Center for the Rehabilitation Counseling Research and Education Center, and we do communicate a lot about supervision and working with students and working with supervisors at sites. So Dr. McGuire-Kulitz, would you like to
I'll pick it up from here. Great, thank you so much. I can top you. I've been teaching practicum and internship for 24 years. So I have a few more years than Dr. Hergenrather. My focus, of course, is online. And in fact, I have a number of my current practicum students that I'm not sure if they're still on today. Everyone is welcome to stay for this session. Just a reminder that it is focused on current site supervisors for internship students and people or agencies that are interested in becoming site supervisors for our practicum and internship students. So that's really who we're talking to today. We are fortunate to have one of our wonderful doc students, Morgan Weiss, will be helping monitor the chat. And since Dr. Hergenrather and I are not going to be able to do that very well, so we'll stop periodically as we go through. If you have questions, please put them in the chat and Morgan will summarize them for us and we'll stop and ask. Like Dr. Froelich, we probably have 2 hours worth of materials, but we will not punish you and make you stay beyond an hour. Even though we enjoy this topic. I do want to remind you that you are getting CRC credits for attending. We will have a PDF of the presentation. So if we don't cover all the slides, you can always go back and look at the slides. And that, once again, we're focused on current and future GW internship supervisors. Okay, so our focus today is on the following. We're going to present our learning objectives. We're going to talk about an introduction to best practices, an overview of clinical supervision, models of supervision, methods of supervision, and research and resources. I'm not sure how far we're going to get with the research and resources in an hour, but we'll do the best that we can. And as always, please, if you have questions, please put them in the chat and we'll try and stop and address them. So our learning objectives are that after attending this session, you should be able to describe what is meant by clinical supervision, be aware of some models of clinical supervision, understand the role of the site supervisor, what they play with the counselor's development, and understand the requirements for supervisors when supervising GW students. And I want to add, I guess, an asterisk here and say, we follow KCREP guidelines. So I feel confident making the broad statement that our requirements would be the same as any other KCREP accredited program. So I do want to make a statement on anti-racism, and that is that being anti-racist involves the internal, interpersonal, institutional, and structural commitment to confront and eliminate racism that exists in ideals and policies. It's a critical reflection of our individual and collective responsibilities to dismantle white supremacy and advance anti-oppressive androgyny. And the Counseling and Human Development Office at Department at GW, and the Graduate School of Education is committed to practices that, one, address racism and discrimination directly through explicit discussion and action. Two, increase awareness of prejudice and confront its effects through discussion of and representation on racism, stereotyping, and discrimination in society. Three, disrupt and dismantle the systems and structures that codify institutional racism. Four, disrupt and dismantle racial power inequities within the department, the university, and the counseling profession. Five, deeply challenge and hold all members of the counseling community accountable to advance their own anti-racism praxis and ensure that the content and delivery of the curricula reflects this focus. So clinical supervision. You know, it's interesting, a number of years ago, I was in a training with a number of state training directors at a national conference. And at that time, the state training coordinator, Harriet Ann Litwin, came up to me and she said, "This is all fine, but what about clinical supervision? Everyone talks about supervision, but I don't feel that we're preparing our supervisors to be good clinical supervisors." And that started ourselves, as well as Dr. Jim Herbert out at Penn State, looking at what is clinical supervision, what are the attributes of good clinical supervision, and what do we need to be thinking about? So we know that the purpose is to enhance professional functioning of more junior folks and provide additional training to develop, expand skills and attitudes and thinking, to provide additional support, to monitor quality of professional services offered to clients, and to serve as a gatekeeper of the professional. And that's a citation from Barnard and Goodyear in 2004. So we're going to go back to the CACREP standards. And according to the 2016 CACREP standards, we need to look at the practicum, supervision, both individual and group, supervision of students, supervisor, individual and group, and in the practicum, and then in the internship. So CACREP says, and these are the guidelines that we follow and any other CACREP accredited program will follow, requires that supervisors have a minimum of a master's degree, preferably in counseling or related profession, relevant certifications and or licenses, a CRC, an LPC, a minimum of 2 years of pertinent professional experience in the specialty area in which the student is enrolled, knowledge of the program's expectations, requirements, and evaluation procedures for students, and relevant training in counseling supervision. I know with the LPC, Dr. Froelich referenced that as an LPC supervisor in Virginia, he has received additional training in that area and can list that as a designation. So for the practicum, students complete supervised counseling practicum experience that total a minimum of 100 clock hours over a full academic term that is a minimum of 12 weeks. Practicum students complete at least 40 hours. Let me repeat that again. A minimum of 40 hours of direct service with actual clients that contributes to the development of their counseling skills. Practicum students have weekly interaction with supervisors that average about 1 hour per week of individual and or triadic supervision throughout the practicum by a counselor education program faculty member, such as myself or Dr. Hergenrather, a student supervisor who's under the supervision of a counselor education program faculty member, or a site supervisor who's working in consultation on a regular basis with a counselor education program faculty member in accordance with the supervision agreement. At George Washington University, we are required to have a a site cooperative agreement with every location that provides supervision. If it's a state agency, then we have one agreement for the entire agency. So even if someone's in different offices, it's the agreement with the state of Ohio. It's an agreement with vocational rehabilitation. It's agreement with Montana vocational rehabilitation. It's agreement with Vermont vocational rehabilitation. And those agreements are good for 5 years. At the end of 5 years, we then work to renew the cooperative agreement. So after successful completion of the practicum, students complete 600 hours of supervised counseling internship in roles and settings relevant to their specialty area. So internship students complete at least 240 clock hours of direct services. Now, this is over 2 semesters. The practicum is 1 semester, and it's followed by internship 1 and advanced internship 2. So after 2 semesters of internship, they must have completed 240 clock hours of direct services, a minimum. Pardon me. Internship students have weekly interaction with supervisors that average 1 hour per week of individual and/or triadic supervision throughout the internship, provided by the site supervisor, the counselor education program faculty, or a student supervisor who's under the supervision of a counselor education program faculty member. Internship students participate in an average of 1.5 hours per week of group supervision on a regular schedule throughout the internship. Group supervision is provided by the counselor education program faculty. Once again, myself, Dr. Hergenrather, Dr. Froelich, and we have other faculty, or a student supervisor who's under the supervision of a counselor education program faculty. So professional development. Oops, sorry. It's a critical element of counselor development. No professional consensus regarding definition. Professional disposition. Counselor dispositions are aspects of personal and professional functioning that subsume intellective factors, personality, characteristics, relational proficiencies, values orientation, accounted for by 9 correlated but independent factors. Such dispositions are both critical prerequisites and predictors of professional competence. That's Miller 2020. So in terms of multicultural considerations, this is section D in the KCREP 2016 standards. These standards seek to reduce bias, minimize discrimination, and prevent harm. CRCs work in partnership with a range of diverse clients to individualize rehabilitation counselor services and to promote client welfare in the progression towards their personal, career, educational, and independent living goals. CRCs consider multicultural competencies when working with clients from diverse racial, cultural, and ethnic groups. This section features the attitudes and behaviors of a multicultural competent CRC who maintains an awareness of self and others. And section D describes the ethical responsibility of CRCs to exhibit cultural knowledge and skills aligned with the cultural values of the profession. In terms of section 1, supervision, training, and teaching, Supervision and training promote the mission, goals, values, and knowledge of the rehabilitation counseling profession by fostering supervisee growth and welfare, supporting them in development and progression towards professional goals. This occurs both in academic and work environment and may occur face-to-face, online, or in hybrid formats. To promote ethical behavior and safeguard client welfare, CRC supervisors and educators aspire to foster meaningful and respectful professional relationships and to maintain appropriate boundaries with supervisees and students. I think Dr. Froelich did an excellent job talking about this under the CRC ethics in the previous presentation. They have theoretical and pedagogical foundations for the work, and they have knowledge of supervision models, which we're going to talk about shortly, and aim to be fair, accurate, and honest in their assessments of supervisees and students. CRC supervisors and educators strive to assist students and supervisees in developing their counseling knowledge and skills and address barriers to competent practice. And I hate to use this word, but they must serve as a gatekeeping function to ensure that a minimal level of competency is achieved where the supervisee can assume professional counseling roles. CRC supervisors and educators strive to assist students and supervisees in developing their counseling knowledge and skills and to address barriers to competent practices, and to ensure that a minimal level of competency is achieved where the supervisee assumes professional counseling roles. Okay, before we move on, I want to stop for a minute and ask Morgan. Morgan, were there any questions that came up in the chat or before we move forward?
I do not see any questions in the chat. The only thing that came up was, if this is something that could be generalized and not just for GW. And I said this could be relevant for anyone. So you're free to keep going unless anybody has questions now.
Okay, I'll give it a second. All right, Dr. Hergenrather, was this where you were going to pick up?
This is where I'll pick up, Dr.
Okay.
Morgan-Corlett.
Thank you.
Thank you. I do want to share with you, so if you do hold the CRC credential and you are a supervisor for an intern, please review the CRC continuing education guidelines because you can earn CRC continuing education for being a supervisor for an academic period. So just consult the CRCC, and on the website, they'll actually provide you with a link for that.
Thank you, Dr. Hergenrather. And they're very generous with the hours they will give for supervision, acknowledging the amount of time and dedication it takes to be able to do that. So please be aware of that. So how do I get it? We write a letter acknowledging the amount of the number of semesters and the time that you put, the name of the student, and when they graduated. Or if you're only doing it for 1 or 2 semesters, we can do it for 1 or 2. It doesn't have to be the entire time. So thank you.
Sure. So let's look at what are some of the best practices in counselor supervision. So if we think about supervision, and again, this is applicable to our supervisors of our students and also for supervision of counseling practice in general. So some of the best practices are working with the supervisee in goal setting, providing feedback, how to conduct supervision. What do your sessions look like? Is it student initiated? Is it supervisor initiated? Is it one-on-one? Is it triadic supervision? Do the clients bring recordings of client sessions? Do they provide notes? Do they provide information on challenges that they're having with clients, strengths that they're having? Also, thinking about the diversity and advocacy considerations, thinking about that those of the supervisor, the client, and the supervisee. Ethical considerations, and we'll talk about this in subsequent slides. Documentation. Documentation would also be the timeliness of documentation. Also the requirements of documentation, but also learning the documentation system. Evaluation, what are the types of assessments? How are the evaluations presented? But the evaluations of the supervisees. When we're thinking about the supervisee, there is an assessment referred to as a supervisor working alliance inventory. And so that's provided to the supervisee to complete in regard to looking at two components. And those are usually the rapport building with the supervisor and the supervisee, and also the client focus. And that's a supervisor working alliance inventory. There's also the working alliance inventory that supervisors will review, and that's the relationship between the student who's the trainee and the client. It's also a tool used for counselors and to assess the working relationship between the client and the counselor in regard to bonds and tasks. So this is one slide of some of the best practices. But when we think about supervision, supervision can be considered a hierarchical and evaluative relationship. So Barkham and others, 2021, and this is from the book Bergen and Garfield's Handbook of Psychotherapy and Behavior Change, suggests that in being a supervisor, we really seek to promote the professional development of the supervisee through some interpersonal processes. We are involved in mutual problem solving. We're also involved in instruction and evaluation. We're mentors. We're also role modeling ethical practice. And again, we are the gatekeeper regarding the competence of those seeking to enter the profession. If we think about clinical supervision, I think what we want to understand in our profession is that counselor supervision and clinical supervision are often used interchangeably. And if we think about these, thinking about our role as a supervisor, we could think about the administrative role and then also the clinical, working with our clients and working with our supervisees. And what are those clinical aspects of the physician, then also the administrative as in regard to the documentation. The next slide, please. And in regard to our clients, our supervisees, and our supervisors, we really must be cognizant of the social locations of the supervisor, the supervisee, and the client, and how these have significant correlations with outcomes. And the research does suggest this, and it also suggests for our students who are supervisees to acknowledge within the first few sessions client social locations. And when clients discuss social locations, to have an understanding of the social location upon the presenting concern. These may be issues of racism, oppression. These could be how stigma can impact someone. And so how do we broach those topics? And when a client brings these up, how do we explore these? How do we help our supervisees explore these in regard to looking at the impacts these may have on outcomes? So they're significantly related to client outcomes, and the research suggests that these issues are also correlated with the level of the mental health of the clients, consumers that we serve. Next slide, please.
Sorry. There we go.
Okay. I mentioned earlier the Supervisory Working Alliance. So we will address this many times. You know, it was historically developed in the 1980s. There's actually another version of this. So the Supervisory Working Alliance, there's an inventory, and it really addresses the relationship between the supervisor and the supervisee. And again, if we look at these in regard to the Supervisor Working Alliance, we're looking at the rapport between the supervisor and the supervisee. We're looking at the client focus. And if we look as a supervisor, if we're looking at the working alliance inventory between our supervisee and the client, we're going to look at the goals, the tasks, and the bonds. And so that is our supervisee's ability to set goals with the clients. Looking at this from a social justice perspective, looking at the client's social locations, and how those can impact the client's ability to identify and actually pursue their goals. And we're also looking at the tasks. What are the tasks that are involved, and the bonds? So the bonds, when we're looking at that working alliance between our supervisee and the client. So what are those levels of trust? What are those levels of collaboration that take place? Are our supervisees working with the client, with the consumer, to collaborate on what the goals are, to looking at the plan, and also looking at the social locations of the client to see how those can impact the client pursuing, or the motivation of the client to pursue the outcomes, which would be competitive integrated employment. Next slide, please. So there are some models of supervision that we're going to talk about today. One will be an integrated development model. And if we look at this, we're going to look at developments in regard to helping increase self-awareness, motivation, and autonomy. Next slide, please. So this model, when we're thinking about the supervisor, and how does a supervisor really initiate the supervision? And so sometimes what we find out, in order to increase self-efficacy of supervisees, if we begin supervision more of a structured manner, and the structured manner, what the research suggests, is that it reduces anxiety for supervisees. And why is that? Because they know what's going to take place during the session. How many of us have gone to meetings where there's been no agenda, or you've started a meeting with someone and then suddenly, the agenda is missing, people aren't following it. If we think about just how meetings are organized and how we structure just business meetings in our profession, we know that there's a structure there so that what is going to be discussed, we know that there is an order and a sequence. And so the research suggests that when you have your relationship with your supervisee, that there is a structure in place. This doesn't mean that the structure can't be flexible, but initiating that structure. So then the next step is, after this structure has been developed, moving a greater use of conceptualization. And so how do our supervisees conceptualize their clients? And when we're talking about conceptualization, thinking about the presenting concern, thinking about the client demographics, thinking about the client's social locations, thinking about the client's ability and collaboration in setting the goals, thinking about their pathways to goals. How have they been successful in setting pathways and setting goals, looking at their motivations. But I think also another aspect of this is looking at the value of the outcome. So how does the client perceive the value of the outcome of this goal? But then also, what are the client's expectations or the consumer's expectations? And do these align with the counselor's expectations? Sometimes they don't. Sometimes they do. We hope that they do. But sometimes what also can happen is there may not be a clear definition, right, of the rehabilitation counselor's role and the client's role. And so how do we make sure that there's an understanding of the process and the expectations of the services? And I think that finally looked into how clients develop their own orientation. If we look at the discrimination model, the areas of focus are really going to be the skills. How do the students demonstrate the skills well? How do they conceptualize this case? And also the personal counseling style. So students will bring their personality into the room, but we also have guidelines within our profession that help us frame the demeanor in which we provide those services. So the role that the supervisor plays, that we play as supervisors, we play the teacher, right? The instructor. And then we also, as the counselor, so we're understanding our supervisees, we're working with them, processing these. And then also when our supervisees have some questions about services that are provided, or there may be a crisis with the client, or there could be some issues that you're just unaware of how to address, we serve in the consultant role. And so we serve in these roles, I would say, not in any specific order, but I think when we develop that consultant role, the clients have clearly developed trust with us. And we're in the counselor role, we're able to self-disclose. So there's another area of trust. And then in the teacher, we're providing the instruction because we're focusing on the professional development. Next slide, please. Some orientation-specific approaches to supervision is person-centered. Cognitive behavioral, looking at the behaviors and extinguishing inappropriate behaviors. So what are those consequences of the behaviors? Thinking about a constructivist narrative. So really looking at the supervisee's strengths. And kind of what I would say is, so you're engaging this behavior, what's the rest of the story? How do you think this is going to end? And so understanding the supervisee's perspective, but then also using our role as a mentor to assist them with our own experiences. The systems is exploring the family origin on issues and supervision, so introducing evidence-based practices, family therapy models. So here again, it's from a systems approach and looking at the factors that may interact. Next slide, please. In a rehabilitation model of supervision, this tripartite model of supervision really looks to highlight some of those categories of activities that are applicable across our counseling specializations. And so these counseling specializations could include rehabilitation counseling, clinical mental health counseling, and school counseling. Next slide, please. So this model is based on, as we referred to earlier, the Supervisory Working Alliance. And again, so that's looking at some areas such as rapport building. So how am I building rapport with my supervisee? And then also the focus of the clients that my supervisee is serving. The next slide, please. So if we look at this model of supervision, we can see that there are three components of it in this circle. So the diagram that I'm referring to has three overlapping circles. And where all circles overlap is the Supervisory Working Alliance, which is the intersection of our role as a supervisor to provide professional development, also administrative supervision for the administrative tasks of the role, and then also clinical supervision for the clinical components and working with our clients. And what we find is correlated with these are strategic leadership and how this is provided, transformational learning, and then quality assurance. Next slide, please. There is an updated model, supervision model for VR professionals. And this research is conducted by Jim Herbert from the University of Pennsylvania. And so with this model, there's a clear, distinct approach to administrative work and then the clinical counselor work. So the administrative, again, focuses on the organizational policies of the site and the procedures, and then also provides a focus on the clinical, the counselor aspect. So here, looking at our counselor, our supervisee skills and awareness of the professional development and areas for growth. It does integrate those models that we talked about earlier, right? The counselor, the teacher, and the consultant of the discriminant model. We do have some information about that on our SITVR website, and so there is a link on this slide. Next slide, please. The social justice approach by Dollarhide and others in 2020. So this is practiced and modeled and taught with two goals in mind. One is the supervisee and client liberation. And the second is the transformation of the profession toward greater social justice overall. And so here again, looking and working with our supervisee and the clients in regard to social locations and looking to ensure that we're providing a social justice, anti-racist, anti-oppressive model of supervision, understanding the client's social locations and exploring how these may impact the client goals or the client's presenting issues. And for us to address these within the first 4 sessions and understand the purposes of broaching these topics and how important that is to develop the relationship. Next slide, please. So if we look at the social justice supervision model, so we could, and we understand this. So it's a cyclical pattern of self-evaluation, and from self-evaluation, another stage is exploration, and then another stage is teaching, and another stage is the process. And within these, for the self-evaluation, for example, the supervisor conducts the self-evaluation, examining the cultures and biases embedded in the supervision process. In regard to the exploration, the supervisor really facilitates the supervisee's identity exploration and to understand what the supervisee's cultural identities are and how those may impact their relationship with the client or how they may perceive even the client's presenting concerns from their perspective, and how to look at this from a cultural perspective. And so we, as the supervisor, are assisting our clients to view this through the client's lived experiences and also kind of to reflect upon some of our own views and perceptions of clients and the abilities of our clients. And we as a supervisor are able to help the clients understand this and to break down any bias, prejudice, discrimination that they may be unaware of, to understand and appreciate cultural humility within that session, and also empowering our clients. So I think with this segment, we're really assisting the client to kind of unlearn some things and to provide services more in a multicultural perspective. The next in the teach, and so what we're looking,
That's my fault.
in the teaching section. So we're looking at, once we've done the exploration, working with our supervisees to help them understand models of social justice and systems work to engage with our clients. And then the last section, the process. And so what we're doing is we're working with our supervisees to look at processes within systems to further explore social justice work. So it looks at working with the supervisee, exploring the supervisee's perceptions, skills, abilities from a multicultural perspective to help them empower and understand. And then we're looking at the supervisor being basically a model and a coach to reinforce this within the system. And then we're working with the supervisors, working with the supervisee within the system to provide those models. Next slide, please.
And I think I pick it up here for a couple slides. Before we get going, I wanted to reach back out to Morgan and ask Morgan, any comments or questions from the chat?
Yeah, we have a couple comments, but I want to start with the questions first.
Okay.
So we have someone in the chat who has previously supervised students, specifically RC students, and they wanted to know, like, if you guys could provide any insight about how to request more interns, or if we would be talking about that later on in the presentation.
Certainly, if you're interested in requesting more of our interns for the online program, contact Dr. Marwara Kuwitz. For the on-campus program, please contact me. We're glad to talk with you.
At the bottom of this slide is all of our contact information, including our emails and our phone numbers. So please feel free to reach out to us. And we don't always have interns who want to, I mean, I often have interns that want to work remotely, but if we don't, we're happy to recommend other programs, other academic programs across the country who might have possibilities.
Okay. The next question is, can regular CRCs who aren't supervisors supervise interns, or does one have to have the title of supervisor?
You would have to have experience as a supervisor. So I believe it is 2 years experience as a supervisor.
But 2 years experience as a counselor, you don't have to carry the title supervisor to supervise an intern. In fact, many times students, and we actually prefer that their supervisor, if they're a CRC, not also provide the clinical piece. So we'll try to find someone else in their office who is a CRC to do that. It's up to the individual and the person who's the supervisor in the office. You do not have to carry the title supervisor to be an internship supervisor.
You are required to have relevant training in counselor supervision. And for example, attending a session like this today, is supervision training. We like our supervisors to have had training annually. And so we do, and this is at GW, and so we do provide supervision training. And that's one of the reasons that we have it at our symposium every year. But we also have other top opportunities for supervisor training through our CITVR website.
That's the Center for Innovative Training and Vocational Rehabilitation. In fact, we have, I believe, 5 modules that Dr. Herbert from Penn State created for us that would meet that requirement.
Okay. Dr. McGuire-Couletz, we have someone who wants you to elaborate a little bit more on why you prefer internship supervisors be different than their workplace supervisor.
Oh, I don't think that's necessarily mine. I don't think I have a preference, but sometimes people prefer for their clinical supervision not to have their supervisor doing it. And sometimes supervisors prefer it kind of muddies the water about professional relationships. I've certainly had supervisors who not only were the person's supervisor in an office, but also their CRC supervisor. So let me put it this way. I try to decide it on a case-by-case basis.
Thank you. And just participants just emphasize that, oh, wait a minute. We have some questions coming in. So I'll leave the comments for later. What is the process for getting CRC credits for intern supervision?
Okay, what you would do is either if you're supervising someone online, I would write the letter. If you're supervising someone on campus, Dr. Hergenrather would write a letter to CRC identifying the dates, the name of the student, the dates that you provided supervision, the academic number of hours that were over that period, and then CRC will assign the hours. I believe if you go into the CRC website, it has that information.
It will be stated there in the document on how to accrue continuing education units. And so you will need something written from the department who is providing the supervision at the university. And like Dr. McGuire-Couletz said, you will have to state the number of quarter hours or semester hours and the duration of time and the student's name and when they graduate from the program. Sorry, Morgan, you had a question.
No, it's okay. It's okay. And then the final question is, what is your take on an agency hiring supervisors who don't have a CRC or something close to it?
Well, I'm going to be honest and admit I'm biased in favor of CRC counselors because I feel they're the best qualified to be able to provide services and with persons with disabilities. I think you heard that from Dr. Froelich when he was talking about the CRC, and you'll certainly hear that from myself. And in this case, I can speak for Dr. Hergenrather.
I would agree.
Yeah, we feel very strongly about hiring certified rehabilitation counselors.
And I would support that by saying, our code of ethics, right? If we're certified, we have a code of ethics, and we are utilizing that in our supervision. This isn't to say that persons couldn't supervise rehabilitation counselors, but I do believe that they gain a specific insight from the certified rehabilitation counselor as a supervisor.
Do we have
time for a couple more?
Sure. Sure.
Okay, I'm going to make sure you guys can, finish up. So the ones that are in the chat right now, guys, I'm going to finish up with those so they can finish the presentation. So if I'm reading this correctly, must one doing the supervision of VR interns be a mandator holder of CRC?
Yes, you must have you can either have a CRC or an LPC.
Okay. And then do we have to wait until the student graduates to earn CRC credits for
Nope,
supervision?
I've written it for people at the end of a semester because they're up for renewal and they needed the credits, and that's okay.
All right. And that just about does it. The only comments were that without an agenda, nothing can get accomplished at times. And then balancing between administrative and council supervision can be very tricky.
Yes, I agree.
And sometimes the supervision agenda can change, right? Depending on what the client, I'm sorry, the supervisee brings in, or what the supervisor sees as a pertinent issue for the professional development or for client consumer well-being.
Thanks, Morgan. Great job.
Yes.
Okay, so we're going to move into trauma-informed supervision as another model.
And I think what we do,
go
because
ahead.
we have 14 minutes left.
Okay.
So I think we may just kind of highlight some of these.
Okay.
And use the slides as
It's just a thing, right? So we have trauma-informed supervision, and which is another model in terms of that, and I'll leave that for folks to follow. And then I think it's very important to consider, we've considered very important, supervision dynamic, you know, whether you do it individually, triadic, or in terms of a group, you know, what is the best way to give that supervision? I personally feel a combination is very helpful. I think there is, I know I teach practicum and internship classes. We meet as a group. I have had students share with me that when we do case studies or presentations, how helpful it is to hear someone that they consider to be very experienced share that they're having challenges with the client because they feel they don't have enough experience. So I think we all can encounter challenges and difficulties when dealing with different people, different types of disabilities, different types of family dynamics. And I think that helps to kind of talk that through. So, and then some common supervision methods are obviously verbal reports. At GW, we ask our practicum and internship supervisors to provide reports in writing, which they share with the person on site. And then obviously reviewing videos, transcripts helps with the individual. Verbatim reports, transcripts is very helpful. The case reviews I talked about earlier, going over a case, sharing the information, getting other input, getting a different perspective can be very helpful. And video and audio taping also can be very, very helpful with that. Obviously, I can't do this online, but direct observation with a two-way mirror, and then sharing with someone. Our students at GW, their interview skills, even our online students come on campus and get feedback. Dr. Froelich teaches that class. Obviously, modeling, being able to go out and observe and model different counseling techniques and so forth. Role playing also helps. And webcam or Zoom is also a great method as well. I think I think you're picking up this one. Yeah.
I am. So another important aspect of supervision is providing within a multicultural and socially just counseling competencies. And so really understanding the intersection of the social locations, looking at the influence of oppression, racism, and how that impacts the mental health and well-being of our clients. And how can you integrate this into the counseling process? One thing that I do want to highlight is that the research over the years has suggested in working with supervisees who may have a different social location than their supervisor, is that 2 points were salient, and I teach a supervision course. And one is, don't expect your supervisee to educate you on these topics, on their social locations. And the second is, supervisees can feel exhausted. They have to continually inform their supervisor about their culture or their social locations. And so here again, how can we as supervisors make sure that we're well informed of cultural diversities, populations, and we can do that through training, we can do that through our involvement with the provision of services. So again, we don't want to rely on our supervisee to train us about social locations. It causes a rupture in the supervisory working alliance. It's the research has presented. Next slide, please. A multicultural and social justice praxis. If we look at the differences between the privileged counselor, the marginalized counselor, the marginalized client, and the privileged client. Here again, looking at this from a multicultural and social justice praxis, and we would look at the client's worldview, the counselor's worldview, the counseling perspective, attitudes and beliefs toward counseling, attitudes and beliefs and knowledge about counseling. And I think an important aspect of this is understanding clients' expectations and counselors' expectations of the counseling process in regard to outcomes and services provided, and what we can do and how we can provide this within a multicultural and socially just perspective. Next slide, please. What are the factors that are positively associated with the Supervisory Working Alliance? I think we've talked about this alliance. So is there a supervision contract? Typically what we will find with supervisors, there will be a contract. If we look, for example, in the state of Maryland or the state of Virginia, there is a supervisor contract which provides information on the supervisor, the credentials that they have, the type of orientation that they have in regard to supervision. It's not uncommon for supervisors to provide this to their supervisees so they understand the engagement, the type of framing, the supervision structure, what that will look like, and how supervision will be covered. The next is regularly scheduled contact with the supervisor. For our students in our counseling programs, it would be meeting an average of 1 hour per week. And so that means it could be 1 hour a week, it could be 25 minutes here, it could be 30 minutes here during the week. So it could be split up, but it's an average of 1 hour per week. I think then also the counselor's rating of importance of the Supervisory Working Alliance. And so if the Supervisor Working Alliance is rated high, you're going to see this more positively associated with also the working alliance between the supervisee and their client and client outcomes. Next slide, please. Professional dispositions. So we will evaluate our students' professional dispositions in their practicum semester, and then also the last semester of internship. So this is required by our accreditation bodies, KCREP. And so we have a professional disposition scale that's been created, and we have to report this out. What we find is that our dispositions, we assess them in the first course, which is the foundations. We assess them then in the experiential courses, such as interviewing skills course, the practicum course, and the second semester of internship. And we actually review these and see how the disposition has changed over time.